Charles Miller here from Texas 2036, testifying on the bill.
I'm going to put you on my timer because he stepped out for a moment.
Okay. We think that a state-based exchange is a concept that has a lot of potential, and we look forward to working through the stakeholder process to get the best version of this bill going forward. Want to start out by recognizing your efforts last session in getting SB 1296 passed, which was, as a precursor, the bill that introduced Texas's ability to do rate review. It had a huge impact on the enrollment in the marketplace, probably the single biggest thing the state has done to increase insured lives over the last decade. So as a starting point, I think that's great. And what we're looking forward to is doing more by taking over more functionality from the state exchange. At Texas 2036, we've conducted a lengthy project that we call Who Are the Uninsured? And our goal here is simply to find out why is it that 2 million people are eligible but unenrolled. And those reasons are multiple, but what we heard time and time again was frustrations with going through the enrollment process on the federal exchange, as well as a lack of awareness of their eligibility for subsidies. There were also other reasons. There was political opposition to signing up for what they perceived as Obamacare. There were branding issues with the federal exchange that people didn't want that product because it was perceived as too expensive. And no matter what information you gave them, they weren't going to change their mind. So there is an opportunity here for a rebranding of this product that is actually very good. As was mentioned, over 60% of the people that are signing up are getting policies that are $10 a month or less, whereas the perception is that these things are costing $300 a month or more. And so an opportunity to change perceptions about this by taking over the operation of the exchange could be a benefit. I want to talk about kind of the three distinct parts of this bill. There's the possibility of taking over the exchange itself, which I'll call the operational part of it. There are the financial benefits that I think have been discussed extensively. I'm happy to answer any questions on those, but don't want to go into that anymore. And then there's the 1332 waiver aspect. Operationally, there are some potential benefits here that I think really would be things like making sure that the website is easier to operate, that we're able to present information more clearly. And what we heard from our focus groups time and time again was stop spam calling people after they sign up and present information more clearly when they show up. You shouldn't have to go through and enter in information for 45 minutes before you get a list of plans and what they might cost you. That is driving people away. The spam calls that they get after they submit their information is causing decision paralysis and causing them to not sign up as well. These are operational things that the state could do better at, but I tend to agree with some of the comments that have been made that in order for an exchange to do some of these things which are hard, we need to give them direction. There needs to be a mission and an objective, and we would suggest that those missions and objectives be things like make the enrollment process easier, specialize your targeted outreach to people who are eligible but unenrolled, and figure out how to do that. That's not always the easiest thing. And if we don't tell them to do that, they may default to not doing it because those things are hard. And we see this with our state agencies, that if we don't give them specific direction, the default is paralysis. And so in order to do that, we need to provide that mission, that goal, so that every step of the decision-making process, they can turn back and say, this is our mission. We're going to make a decision in order to do this, to conduct better outreach, to lower premiums. And so specifying those things out may be a way to thread the needle of not being overly prescriptive, but giving whatever entity it is that operates this exchange a mission and objective to reduce the number of people that are uninsured here in Texas.
I got to cut you off right there, but I have a question for you.
Sure.
Do you have any other suggestions?
I think that there are some technical concerns. Other states have done this. I am less concerned about the technical feasibility of us being able to do this. That being said, I do think that it would be prudent to put in the bill strong fail-safes so that if we get to a point where we're about, ready to launch, and we do some tests and it's not ready to go, that we have the ability to call it off and continue using that federal exchange, push it back another year. I think that's prudent to put that in there and make sure that those are robust and that we have sign-off from all the people that would be using this. That seems prudent to me. The other thing that I would say is that there's this feature on the federal exchange called Enhanced Direct Enrollment, and this allows third-party software like Health Sherpa as an example. Enrollment through these third-party entities has been massive and explains a huge part of the enrollment growth, especially in Texas over the last several years. Right now, there's no state exchange that has that capability. That doesn't mean that there couldn't be. Georgia is planning to include that capability in their state exchange that they're rolling out, and it is a feature that I think Texas needs to make sure that they include in an exchange going forward so that we do have that continued enrollment growth.
Thank you. Members, any questions? The chair recognizes Chairman Frank.
I just wanted to understand what you meant by the enhanced.
Sure. So typically we think of people going to healthcare.gov and signing up through that process. What enhanced direct enrollment allows is for you to use a broker service or a third-party website to do that enrollment process. And so some of these third-party enrollment processors like Health Sherpa have created a easier and more consumer-friendly way to get that information in and submitted to the federal government so that they can.
Is that I'm assuming then they're getting paid by the federal government?
I don't actually know the details of the payment systems there. I believe that there are people here today who would have that information.
Guessing they're not doing it for free.
I would assume that there is some way that they're being.
Maybe they are.
Yeah, I would assume they're able to make money off this. I don't know the exact details, so I don't want to get in.
No, it's fine. I appreciate you bringing it to our attention, though. That's very interesting.
Members, any other questions? If not, Charles, thank you for being here. It's always nice to see you.